Okay, today's mini lecture that we're going to do is very important for everybody because this is what I found out just for me recently. I have cavities in my mouth and I cracked my tooth, and I'm not close to the dentist on the mainland where I usually go to a biodentist to be able to fix my little aches and pains. Okay, so what I'm doing here is I'm going to show you, because lots of people realistically, they go to the dentist and they get more destruction done to their teeth than they do good, is because they're not actually feeding their teeth. They're not understanding how to replenish enamel and or the necessary elements to your teeth to harden them up. Okay, so we have to understand there's two different bacteria, okay, classes, not bacteria in your mouth, but classes, the way I look at it. Remember, you have flesh-eating bacteria that eat your gums. Okay, that eats your gums, and you see people with receding gums as they get older, or they're smoking cigarettes, whatever they're doing. This is flesh-eating bacteria from irritation, but what it is, it's irritation of the flesh, and there's bacteria in the mouth, and they eat the flesh that is unprotected because it's been assaulted. Okay, and then you have the second type, which is very important to understand, because most people, I've never heard anybody talk about this, but it's called not flesh-eating bacteria, but enamel-eating bacteria. Okay, it's very not understood, only because we think sometimes it's just bacteria in our mouth that's giving us our cavities, and that is a big problem, but it's not the problem that you can't go ahead and actually solve yourself to regrow, not your teeth, okay? And that has been done. These are protocols right now to stop your cavities, okay, to stop the bacteria that is then everybody's gums, below the gum line in the tongue, and to be able to stop the flesh-eating bacteria, okay, and enamel-eating bacteria in your mouth. Now, it's not just to stop that, but it's also, remember, you want to do the Trinity of Health and all the different protocols we do, even if it's putting on the hair protocols to be able to see if you can grow your hair back, which we've had many, many, many people be able to stop their hair from disappearing and actually regrow it. And it's not magical, they're hair mites. Okay, remember, there's different protocols and different ideas, but I'm going to show you. We have all these products here right now, and I'm going to show you some pretty different stuff. Okay, so remember, how do you dissolve, okay, the toxicity in your gums? How do you dissolve the bacteria that are on your enamel and they're not leaving? Okay, how do you dissolve the bacteria that's in your gum line and in your tongue? Okay, so remember, dissolve, wash, and renutrify. And this is what I'm going to show you right here. This is going to be a little more advanced for most people, only because this is an Earther Academy video only, because I'm going to show you some different things that, well, you're going to have to make your own decision if you want to do. It's because some of the products we're going to use, they're all over-the-counter products, but some of them are really over-the-counter. So to really understand the teeth, okay, I just want you to understand, if you've got teeth problems right now, you've got teeth problems, and you've got foot problems, hand problems. I'm talking fungus, nail fungus, toe fungus, foot fungus of any type. Okay, you have a precursor to sickness. That's one of the #1 ways for you to be able to see in the near future. Are you going to be healthy? Or are you going to be sick? You're getting cavities right now. It's because you need to change your diet. You need to change a lot of the terrain, as we talk about in the mouth. And this is what this I call it elixir, is going to do for you. So the elixir we're going to make today is a combination of several different products that is going to, well, really, let me tell you my story, really change if you have cavities, if you have gum disease, if you have some type of dysfunction in your mouth. You better stop it now. Remember, all disease doesn't just start in the gut, it starts in the mouth. Okay, so our gums, and this is why a lot of people get certain types of diseases from sexuality, is because they have gum disease. Okay, gum disease. Receding gums is gum disease. Inflamed gums is gum disease. How do you know? When you brush your teeth, and what happens? You get blood. Poof, you should never get blood. When you floss, you have blood everywhere. It's because maybe you're not flossing correctly. Okay, so these are all different pieces here, but the #1 thing you need to do is stop the intrusion of flesh-eating bacteria and enamel-eating bacteria. Okay, so let's just go over a few things real quick here on understanding. First of all, what are teeth made out of? Okay, this is important for people to understand why we're going to use is what we're going to use. It's because you need topical solutions for the tooth, not just by ingesting things so your body can grab it and put it to the tooth. How about putting it on topically to be able to stimulate the enamel, to stimulate this very smart machine to rebuild itself? Remember, it needs the materials to rebuild, number one. But number two, which is most important than number one, not only having the materials, you have to stop the flesh-eating bacteria and the enamel-eating bacteria. The tooth is made up of more phosphorus in any other part of your body. It's all right here in the tooth. Okay? The tooth has miles of tubules inside it. Okay? Miles. And it is a flowing tooth. It's not hard like you think. It is. But inside it has all these little lattice works and canals. And drilling your teeth is not smart. Remember, I've seen lots of sickness. Lots. And this is where you go to the dentist to try to help yourself. Is because you don't know what else to do for yourself. And when you go to the dentist, remember, they are not going to cure your cavities. They're going to temporarily fix them, but they're going to damage your tooth by doing that. Most cavities can be relieved by what I'm going to show you. My little story. I had for 3 months, the last 3 months, okay, a cavity in between my teeth, between my 2 back molars, and I couldn't even put the floss in there. It was so sensitive. Once I got it in there, okay, I get in there, but I had to make faces and wince, and I actually had, many times I had to go ahead and say, what's wrong? Because the floss, remember, is getting caught on the cavity, which is sort of sharp. Okay, that's the bacteria. Remember, arthritis in your bones. What do you think that is? Rheumatoid arthritis on your bones, osteoarthritis on your bones. Those are bone-eating, okay, bacteria. Bone eating is because you have inflammation. You have to have inflammation for these bacteria to be able to live. So brushing your teeth incorrectly, scratching your enamel, scratching your gums, do you think that's doing well? Okay, flossing and not doing it correctly, you're better off not to floss if you don't do it correctly. So the tooth is made up of a massive amount of phosphorus, okay, calcium. This is very important for you to understand. Where are you getting your phosphorus from? Topically on your teeth. And how do you lose your enamel? Well, what happens when you drink a soda? Okay? It's got phosphoric acid in it, and phosphoric acid is eating your enamel away. What happens when you eat dried fruit and pieces of fruit get stuck in the corner of your mouth and you don't really clean them out and floss them, but you go to bed at night and it sits there and it putrefies and it feeds these bacteria. Part of the bacteria that are in your mouth are good bacteria, but there's a lot of ones that are called bullies that turn into black mold. If you look at cavities, and we'll show you pictures on the film here of cavities, what do you think the black part is? It's black mold. So understand, if it's black mold, then what are you going to do? Get rid of the black mold. I'm going to show you 7 different ways to do this. Remember, it's up to you to figure this out, guys. I'm just showing you some different things. These are choices. I had, like I said, 3 months. It was bothering me. I was complaining to everybody here, okay, that my tooth hurt so much and it was aching inside. Then, about maybe 2 weeks ago, I cracked my tooth on the side with an olive pit. Okay, I had pitted olives, and it was pitted, but it had a small little piece, and I was chewing away, and and I cracked my tooth. That was so sensitive, and I had pain in my head. Okay, so I'm going to show you a way to be able to stop, number one, pain analgesic. Okay, that's the number one reason why you go to the dentist. It hurts so bloody much, you can't stand it. You can't eat. You can't do anything. You can't even speak. Okay, but number two, how do you stop now this nerve that is so sensitive that every time you bite, chew, have hot water, cold water, or just sometimes even pull in the air to your mouth, it's so sensitive you can't stand it. Okay, now not only does your mouth hurt, but now you can't even eat. Now you can't really go ahead and actually be this happy person anymore. It's because you got pain in your mouth. So number one thing is you got to stop all of the bacteria. Okay, so phosphorus, number one, boron, okay, and we're going to show you why we're going to use. And you can see I'm just going to go over a couple of quick things here. A few of the ingredients, and we'll tie it together, and I'm going to show you how to make this brew. Okay, again, we're going to use, this is for regrowing back teeth. I'm not talking about your full tooth. talking about parts of your tooth that have dissolved, and I know this works because just in 4 days of me doing this, I have no pain anymore. I couldn't do this the other day. This thing was sore. I cracked my tooth in here, okay, and it was so sensitive, I couldn't even eat a piece of arugula. I couldn't do anything. I had to have smoothies. It's because I couldn't chew anything at all. So when I first took the solution, I'll show you, like I said, how to make it. I put it in my mouth and it hurt so much, okay, on only the spots. And this is where you're going to find out. If you've got damage in your teeth, when you do this solution, immediately it will tell you it's going to work on that spot. It's not going to burn your tongue. It's not going to burn your gums, but it's going to work on the enamel part, and it's very sensitive and it's going to hurt. I almost had to spit mine out the first time I put it in because it hurt that much, but it stopped it immediately. Okay? And the reason being why is because of the ingredients that we put in. Okay, so let me show a few of the ingredients.
Important reminder: all information and ideas are for informational purposes only and are in no way intended as medical advice or as a substitute for medical counseling. Earthshift Products, Dr. Robert Cassar, all of their partners, affiliates, and subsidiaries will not be held accountable for the use or misuse of the information presented therein. This information is not intended as medical advice. The authors, publishers, and speakers of this work are not medical doctors and do not recommend the use of mineral-deficient foods, drugs, or medicines to achieve beauty and to alleviate health challenges. Because there is always some risk involved, all persons involved with the development and distribution of this information are not responsible for any adverse effects or consequences of any kind resulting from the use or misuse of any suggestions or procedures described on our website or Earthshift Live radio talk show or therein.